All right, welcome everybody. Thank you so much for joining in and watching. Here with me today, I have Alison Bodor, who is the Program Director of Diversity and Inclusion at Northwestern Medicine. Just to kind of kick off by giving a little bit of background on her. She originally started the Disability Inclusion Program at Northwestern Medicine in 2015, which then evolved to the Diversity and Inclusion Program in 2018. Before finding her passion in diversity and inclusion, she started as a occupational therapist. So I'm super excited to be able to interview her today. Before we dive right into the questions, just want to give some brief information about the event that she is going to be speaking at. The event is in September 15th through 17th in Washington, D.C. and virtually. It's going to bring together senior leaders within diversity and inclusion and touch upon some key topics like metrics, inclusive leadership, the current COVID-19 environment, and then obviously the topic that Alison is going to be presenting on as well. So I guess with that, would love to just kick off the conversation, Alison, by talking a little bit about the topic that you're going to present on in September.
Yeah, thank you. And I'm really excited to be joining you today and talking a little bit more about diversity and inclusion and the topic for September's event. So the topic that I'm going to be speaking on is creating conversations and a strategy around surrounding other dimensions of diversity to remove stigmas. So those other dimensions of diversity are topics such as disability, the LGBTQ community in particular, sexual orientation, gender identity. Sometimes these are visible or invisible things that don't always get picked up as we're thinking about diversity. Many times our attention is naturally drawn to things related to demographics that we typically collect, such as race, ethnicity, gender, age. But then there are all these other important pieces of a person that we want to appreciate and welcome and embrace as we think about diversity and inclusion holistically. So a lot of my work the past 5 years has really been focusing in on some of those other aspects of diversity and inclusion. So starting and advancing more equitable practices surrounding members of the LGBTQ community, people with disabilities, both visible and invisible, and then also thinking about all the other things such as racial equity. So trying to bring that together full circle for this group to think about what are some of the terms that might be outdated. Because if we start the conversation around things that we might not be talking about, then it becomes a little bit natural and normal to start those conversations within our own workplaces.
Yeah, great. And I would love to, obviously I'm going to ask you a couple questions about that in, further detail, but I guess before we dive in, to that specific session, I think a lot of, diversity and inclusion professionals right now are, obviously have been struggling, with how to, manage the current environment with COVID-19 and kind of everything that's going on. So I would love to hear, your perspective in terms of, how you and your company have, managed the current COVID-19 environment.
Yes, so Northwestern Medicine is a health system in the Chicagoland area. We have 10 hospitals and employ about 30,000 people. So we have quite a large footprint in this area. And being in healthcare and falling, in the middle of this global pandemic, COVID-19, we're obviously here to provide care to our patients and make sure that the communities we serve are also receiving support. So our initial aim was really to protect the health and safety of our workforce, our patients, and our community at large. So with all that being said, I think it's no secret to anyone that there's been statistics out there as far as the racial disparities, the disproportionate care that the Black and African American community have been receiving. We know about the civil unrest that's currently happening, which is magnifying the structural inequities that are within our own systems, at our own organizations. So there's been a lot going on as we think about it related to diversity and inclusion. But just to highlight some things kind of that we tried to address as a whole for the organization was quickly changing from seeing people in person every day for their healthcare visits to adapting to telehealth visits. Shifting people such as myself who aren't considered essential to more remote work. So I've been at home since March. That's when we started our shelter in place and our organization went on lockdown. And then we converted our inpatient units into COVID units. And so now we've been approaching a little bit of a newer normal where we've kind of bent the curve, if you will, related to COVID-19. And are starting to welcome back our patients in person, but still continuing with telehealth visits, and similarly with our workforce as well. But there's been a lot of different ways that Northwestern has mobilized support. I think PPE in general is probably one of the best examples of not only making sure we had the correct PPE, such as masks and N95 in our four walls, but also for our community partners as well. So a lot has been happening as far as we think about it, and it's really hit every corner within Northwestern, and then we want to make sure we're also having impact out in the communities that we serve, try to eliminate any potential disparities in accessing healthcare.
Yeah, it definitely sounds like, you've had a ton on your plate, which is, to be expected, I guess, with everything that's going on. And you just touched upon, all of the, I guess, different types of employees that, are at Northwestern Medicine. So I guess, going back to the topic that, you're going to be presenting on, what are some of the strategies that, you guys have maybe implemented to, better, I guess, accommodate these employees? And I guess, going a step back, what are some of maybe the biggest challenges that, people face when it comes to, accommodating, all these different dimensions of employees and making sure that they feel welcome and safe?
Yeah, a lot of it is on the cultural competence education. We want to develop our workforce in turn to deliver on our patients' first mission. So then we're delivering culturally competent care as well. So I would say the training has been essential throughout. So if we think about it specifically related to disabilities, we provided disability sensitivity training to all of our staff. So it's kind of a standard when you're a new employee or you're going through your annual training. And in other ways, we try to integrate it. But just understanding the laws that protect our patients who have disabilities. How do we accommodate people with disabilities? So if a person is deaf, how do we ensure that they receive a sign language interpreter for their visit if that's how they would like to communicate, or if they're a wheelchair user and they need to come in for a physical exam, that we are putting them into an accessible exam room. So really just trying to provide more awareness through training. And then we try to get into some more topic-specific things and recognize different events. As next month will be the 30th anniversary of the Americans with Disabilities Act. So it's crazy to think 30 years ago there weren't equal rights for individuals with disabilities. For LGBTQ, similarly, we've had a lot of training. One in particular that I think many people gravitate towards is the gender affirming communications. So being able to introduce yourself with your pronouns. So, hi, my name is Alison Bodor. My pronouns are she, her, hers. What are yours? Just being able to say that and then ask the question is sometimes challenging for people. People need to be comfortable with understanding, well, what the heck is a pronoun and how am I supposed to say that? And then how do I respond if somebody thinks I'm crazy because I just asked that question? And there are people who might say, like, don't you know who or what I am? And so then we need to explain like why it's important. We ask because we care. We can't make assumptions. And it's not always apparent what a person prefers to be regarded by as far as their pronouns. So if I'm talking about you to the physician or to someone else, I want to make sure I use the right pronouns. So we start this training as far as understanding the different terms and definitions, how to naturally use that in conversation when it's relevant. It's not always relevant, but especially if you're welcoming someone new to your team, it might be a very nice signal to them that you're creating an affirming environment by introducing yourself, using your pronouns, maybe a fun fact. So it's just kind of an addition to the general way that we introduce someone to our team, or when we just aren't familiar with others who we are around. And so I think overall, elevating the conversation through training, recognizing events. We've developed guidelines and resources, as well as identified experts in these different areas. I would say that one of the greatest challenges to your earlier question is just people aren't sure what to say, and therefore they might not say anything at all. And that silence can send the wrong message. Although unintentional, by being silent, it actually sends the message that one might not care. And so we don't want to send those mixed messages to anyone, that it could actually be taken as implicit that we don't care as it relates to race, gender, sexual orientation, gender identity, disability, military, and so on. And so we just try to hardwire those types of learnings into our day-to-day, so then it's not considered an extra, something that's like added on to a way that we evaluate a practice or a process or develop a policy. It's about who we are.
Yeah, I definitely agree with you. I think, training and education is essential. And so it's great that, you're focusing on that. So I guess, with that, how do you kind of evaluate whether or not that, training and education, some of the other efforts that you're doing is, successful? How do you kind of evaluate inclusion, and what is inclusion to you? And
Right. So a few things. So I usually try to introduce diversity first before talking about inclusion, because diversity, like I said before, isn't always construed holistically. I try to show, like the dimensions of diversity that are both above and below the waterline of visibility. So those things that we can see, such as a person's skin color. So mine is not white, it's brown, and that's and it's okay to say that, and that's a dimension of diversity. You might not be able to see are things such as my religion, my socioeconomic status, any traditions or cultural norms that are part of my life and my family's life. So if I had a physical disability, that would be above the waterline, but what might be invisible below the waterline is if I have something such as autism or a cognitive disability. So when you're looking at this iceberg that shows you things that are above and below that waterline, suddenly people start to see where they kind of line up as we think about diversity. That race is just one piece of it. And so with all that being said, we want to embrace that, invite that, as well as different perspectives into what we do each day. And that is what creates inclusion. It's really creating a sense of belonging across different groups that otherwise might not have been included, whether it's just evaluating a new program, trying to figure out which market to go into. It's a lot of different things, but if you aren't bringing in diverse perspectives, you're not inviting that feedback, you're not prompting that curiosity from within, then we aren't being inclusive. And so I really think of it as kind of this wraparound whenever we consider diversity and inclusion as a whole. Related to how we measure diversity, as you mentioned earlier, the diversity and inclusion program, it started in 2015 with this specific focus on disability inclusion. And since then, it's been rather programmatic. We started our disability inclusion program, then advanced that to LGBTQ inclusion, and then decided, hey, we're going to focus on this as a whole across our organization. And so that has led us into kind of developing a strategy to create an overarching program that then becomes part of our culture. So we're launching our inaugural Employee Resource Group network. So just being able to do that as a milestone, we'll start to begin evaluating and measuring participation within that, our community outreach activities, our cultural competence education that comes from those groups, as well as learnings that we have that we can take for workforce development. So all of those will have unique measurements. Related to training, we do pre and post tests, and we evaluate training in different ways, but participation rates is probably one example, and then also thinking about it across different job groups. And so then looking ahead, like what is our North Star? We want to ultimately have a workforce that reflects the communities and patients that we serve, and that we are able to provide culturally competent care. So it's, looking inward at what we need to do to accomplish that in order to deliver on that patient's first mission and make sure that we reflect the true diversity of our community.
Oh, it's great. And it seems like thinking about all the right things, making the right steps to eventually, I guess, reach the end goal, which is to make sure that everybody feels included and safe. So I guess, I just have one, last question, and that's, you did speak at this event, earlier in January, and, obviously you made the decision to speak again, come September. So I guess, what made you want to come back, and, what are you looking forward to most come September?
Yes. Well, there is no playbook for diversity. It's very much true to the place that you work at, what you adopt as your particular focus areas, and, what's your maturity path. And so I always enjoy going to these conferences because there's a lot of best practice sharing as well as next practice sharing, both from those within the healthcare industry and outside the industry. So I think that not only develops me, but those are learnings that I can take back to Northwestern's diversity and inclusion program. I also like the networking. I do keep in touch with people after I attend. I still keep in touch with people that I attended the conference with in January that I attended. And so I always think that there's a lot of value in that, and because the diversity community is such a small world, and there's so much that we can learn from each other, and many times we lean in on each other to figure out how to solve for the next need at our organizations. And then just an opportunity to listen. I think that that's also really great, because sometimes I think we can all attest to this. We get a little tunnel vision where we're so focused in on a particular area that we might forget that there's even a greater need that we haven't even thought about yet. So it's also nice to hear what others are doing, listen to that, and then think about how that might work where I am.
Yeah, well, we're happy to have you back. Your presentation in January was awesome. And based on the conversation, so far today, it seems like September 1 will be great as well. So we're definitely looking forward to your participation in September, and I know others are as well. So, thank you so much for having this conversation with me today, and we're looking forward to September.
Thank you. Me too.